Now let's look at why this can happen. How is it that we can confuse this topic in such a way that no one takes action? Let's look at JAMA 2021, February. 240 patients with COVID-19. They received a bolus of 200,000 international units of vitamin D3. So before we go any farther with this study, what do you think is the result of using a bolus dose of 200,000 units in acutely ill patients? What do you think is going to be the result there? Probably not good, because we know that this is an acute infection. So the time is running, the clock is running here. And we know that a bolus dose of 200,000 units, which is higher than what I showed you in the chart, which was based on 100,000 units, 200,000 units is going to actually delay the vitamin D response and lead to vitamin D depletion, because the vitamin D clearance pathways are going to be activated. So this is actually not a potent and competent therapy. So now let's look at the actual details. Here's what they showed in their data, is that they waited 11 days from the onset of illness to the initiation of therapy. So again, we're talking about an acute illness with a typical duration of 14 days, and the researchers in this study, published by the American Medical Association, delayed the initiation of treatment for 11 days when they know that this is an acute illness. Furthermore, pharmacologically, we know that this vitamin D is going to need about 7 days to become active. So they waited 11 days to initiate therapy for a therapy that they know, when it's delivered as a bolus, requires another 7 to 10 days to become active. So the active delay, the active actual delay, was at least 18 up to 21 days from the onset of illness. So they waited, again, 18 to 21 days for active therapy for an infection that typically has a duration of 14 days. And you can see that data represented right here. Time from symptom onset to enrollment was at least 10 days, as they show here, but if you read the text of the article, it actually looks more like 11 days. Plus, by looking at several markers here, we see that the vitamin D group was actually more sick than was the placebo group. Again, the vitamin D bolus needs 7 days to peak the 25-hydroxyvitamin D levels amid a background of supraphysiologic vitamin D3, which antagonizes 25-hydroxyvitamin D and induces vitamin D3 clearance pathways such as 24-hydroxylation. So the American Medical Association got exactly what it wanted from this nutritional study, and that is no benefit except to drug sales. And I think this is completely bogus research. You would never see, for example, you would never see a study like this being performed with this structure if it were studying drugs. So, for example, let's imagine that you were looking at a study not of COVID, but of emergency status epilepticus. Let's imagine that it was a study among patients with status epilepticus, an emergency condition, and the researchers waited 11 days for a treatment that needed another 7 days to become active. So a total of 18 days of waiting for active treatment. That would be completely unethical, and it would never get published by any respectable journal. I mean, it would never get published anywhere. And if a study like that were even created by like a graduate student, they would fail whatever course they're in. I mean, that would be total incompetence. So why is complete incompetence allowed when discussing nutrition in the Journal of the American Medical Association when it would never be allowed for an emergency condition being treated with drugs? That would be completely unethical. Let's look at another analogy. Imagine patients with an acute bacterial infection and the researchers waited 18 days to start them on antibiotics. Again, that would be completely unethical. It would never get published. Researchers like that should lose their jobs. But why was this then published by the American Medical Association when they know that acute bolus dosing leads to this increase? This data was published in 2008, 2003, 2011. So everyone in the vitamin D world should have known this, especially if they're going to use bolus dosing. They should at least look at the pharmacology of bolus dosing, and this is what it looks like. A peak in the blood, followed by a peak in the tissues, followed by a slow rise in 25-hydroxyvitamin D that then declines because of the activation of the vitamin D clearance pathways, such as 24-hydroxylation